Если что с ними поговорить, чтобы они мне ответили в чате, там видно будет, да? Все, спасибо. Good afternoon, dear students. Please write down in the chat if you hearing me normally and can see multimedia presentation. Good afternoon, dear students. Please connect with chat. Now will be lecture about physical medicine and rehabilitation. Good afternoon, dear students. Please will call your friends, will say your friends. Now will be lecture. You must be in the connection in the chat. If you can hear and can see, please write down in the chat about this. Okay, good, good. I wait you. Please connect. Okay, very good. Good afternoon. Dear students, my name is Bobrik Yuri Valerich. I am professor of Department Medical Physical Culture and Sports Medicine, Physiotherapy with course of Physical Culture. I will present you lectures about the basis of physical medicine and medical rehabilitation. You must will be conspect of lecture. Why I recommend you will do write down information which you will hearing. It's necessary for good quality educational process. When you will write down conspect of lecture, you better will remember the materials of lecture which will be useful in your practice during practical classes and during your practical work when you will be physician. Okay, dear students, please connecting with chat. We'll start now lectures. Okay, dear students. Content of lecture, we'll discuss definition of rehabilitation, definitions of physical medicine, goals of physical medicine and rehabilitation. We'll say conversation about multidisciplinary rehabilitation team and about principles of physical medicine and rehabilitation. Dear students, you will be doctor, you will pass some clinical discipline and have knowledge about treatment disease, but dear students, the patient also need in the full recovery after finished treatment during some disease. This function take on yourself the rehabilitation. The use of all means aimed at reducing the impact of disabling and handicapping conditions and enabling people with disabilities to achieve optimal social integration. Its definition of rehabilitation, which gave us a World Health Organization. And World Health Organization take important large attentions of problem of rehabilitation. How about types of rehabilitation? There are some types of rehabilitation. It's medical rehabilitation, help a person better in all his daily physical and mental activities related to increasing the potential capabilities and corrections of deformities, recognition of functions. Dear students, medical rehabilitation will provide physician. You, dear students, you will provide medical rehabilitation for your patients. Social rehabilitation. It implies social life, restoration of family, social interactions, or relationship. This type of rehabilitation relies of social workers. Psychological rehabilitation includes psychological restoration of person and confinement to the disabled. Psychological rehabilitation relies as your psychologist. Vocational rehabilitation help those patients who find it's difficulty to get employment. It's type of rehabilitation release of speech therapist, as usually. But as usually, process of rehabilitation, it's complex process, need a combination all types of medical rehabilitation. Physical medicine and rehabilitation is an independent medical concern with the promotions of physical and cognitive functioning activities, participation and modifying personal and environmental factors. It is a multi-professional team. Specialists in physical medicine and rehabilitation have a holistic approach to people with acute and chronic conditions. Rehabilitation, medical rehabilitation, it's the shortest road to the recovery, very often full recovery or improve conditioning of person. Dear students, some words about classification types of medical rehabilitation. Medical rehabilitation also have some types. It's first of all, it's physical rehabilitation when use the methods of physical medicine. Use physical factors. Other types of rehabilitation is pharmacological rehabilitation for more fast recovery, restoration of functioning. Use different types of medicine which help person in the restoration. Other types rehabilitation, medical rehabilitation is surgical rehabilitation, when for stimulate the process of recovery, use surgical operation. Next types, it's orthopedic rehabilitation, when for person use prosthetics and other equipment which help in the adaptation person for environment and reduce some problems with health. Next type of rehabilitation is psychiatric rehabilitation. It's necessary for persons with psychiatric problem, psychiatric disease. It's a special direction in the rehabilitation. Okay, also there are a different specific type of rehabilitation. It's cardio rehabilitation, cardiopulmonary rehabilitation, another name, neurological rehabilitation, and other. What is medical rehabilitation? It's optimizing functional capacity, using existing capabilities of a disabled person, so that his community participation would be optimized. His medical, physical, psychosocial, vocational, and recreation need to be addressed. You can ask me, why is necessary rehabilitation? Maybe without rehabilitation? As usual, rehabilitation needs too much money, too much financial resource. It's not easy. Normal rehabilitation, but dear students, was many scientific investigation which proved one doors which provide investigation in the rehabilitation give profit $10. We will discuss one. What you can see in this picture, the level of disability person who had rehabilitation and person who hadn't rehabilitation. That you can see optimally self-dependent optimum restoration disability was in the person who had rehabilitation. Person who hadn't rehabilitation have very problem that more level of partially dependent and totally dependent handicaps. Invalidization level increased too much. What is aims of physical medicine and rehabilitation? First of all, it's improve quality of life of people with disabilities. Assess where situation, potential and needs. Adopt innovative approach. Develop an action plan to achieve the goals. Allow equity of access to employment for disabled people. Enable a good state of physical, mental, and social health. Develop programs and resources to meet the needs of the patient. World Health Organization had plan. Its plan released in now that it's last year, and have three objectives. It's to remove barriers and improve access to health services, to strengthen and extend rehabilitation, habilitation, assistive technology, assistance and support service, and community-based rehabilitation, to strengthen collections of relevant and internationally comparable data on disability and support research on this. On this picture you can see the goals of physical medicine and rehabilitation. You can see its correct diagnosis, treatment, and rehabilitation. And you can see in the higher part this picture, it's prevention. It's very important moment that it's the most important part of rehabilitation. You can see rehabilitation, you can say rehabilitation, it's restore lost functioning or impaired functioning. But, dear student, now we have conversation about prevention, secondary pathological process, which can be in result of impairment. We will discuss this problem some late in the lecture. The main goal that is to make a disabled person into a differently abled person. Its main task, rehabilitation. On this picture you can see the process of rehabilitation, combination, some types of using of its prosthetic, roboticide, innovation technique, technology, physical rehabilitation, and other. Now, some words about what is impairment, disability, and handicap. As usually, rehabilitation connect with person who has impairment, disability, and handicap. Impairment, any loss of abnormality of a structure of function. Disability, any restrictions or lack of ability to perform a task expected from a normal human being in the same age, sex, and social circumstances. What is handicap? A disadvantage for a given individual resulting from the impairment and disability. So you know about synonyms word of handicap, it's invalidization. as usually, the object for rehabilitation, physical medicine, it's person with apparent disability and invalidization handicap. How about types of handicaps? It can be locomotor problems, visual amblyopia, or blindness. But how about locomotor? It can be amputation, can be hemiparesis or hemiplegia, tetraplegia, tetraparesis, paraplegia, paraparesis, and another problem, visual. It's, I said, but we will repeat, it can be blindness or amblyopia. Hearing and speech, person which have decrease function of hearing or absent hearing function, or have speech problem. For example, alalia, dyslalia. Maybe dysarthria, dysphonia, and other. Persons with cardiopulmonary problems, any disease, cardiopulmonary system can be reasons, many diseases can be reasons, cardiopulmonary system can be reasons of invalidization. For example, infarction myocardium can be reasons invalidization and result this heart insufficiency, pulmonary insufficiency, in result, for example, COPD, chronic obstructive disease, maybe bronchiectatic disease, bronchial asthma, combined with lungs insufficiency. It can be reasons of invalidization person. Intellectually challenged. For example, it can be inherited problem with intellect, problem with cognitive function, or dementia, when cognitive problem appear after trauma, maybe after brain stroke, maybe after any disease, for example, encephalitis, meningitis, and other. That it can be reasons of invalidization or connect with cognitive function, and many reasons. Now we haven't time for discuss all problems. Emotionally disturbed, dear students. It's person with depression, anxiolytic problem, maybe have psychiatric disease, schizophrenia, epilepsy, bipolar disturbances, Dear students, it's really now the word, for example, depression, very actually problems. Many person need special rehabilitation, physical rehabilitation. Disabilities divide on the primary and secondary disabilities. Primary, directly caused by the disease or conditional. For example, paraplegia, the result of trauma, fractures of spine, or maybe any stroke, spinal cord stroke, or maybe some infection disease, any myelitis. Immobility of a limb following, and other. Secondary, which did not exist in the time of onset, but developed subsequently. Soft tissue contracture, the conditioning. What did you remember when we start lecture? Settled lecture, I said, if we didn't provide adequate rehabilitation, medical rehabilitation, complex rehabilitation, appear risk of invalidization, appear risk person become handicapped. What soft tissue contracture? If after trauma, for example, fracture of bones, extremities of maybe after brain stroke, person had hemiparesis, hemiplegia, or monoplegia, and any locomotor nerves problems, and we not will provide correct, adequate rehabilitation, very often formate soft tissue contracture. And without this, person appear problems with do anything. It's problem with social activities. In the problems with walking, person cannot have adequate movements, and depending from other people, it's really problem. It's need too much money from budget of family or maybe from budget of country for help this person and provide adequate adaptation. But why I said you about economical investigation, $1 which provide investigation in the rehabilitation give $10 economic profit for budget of family, for budget of country. Please remember about this. It's very important information. Now, who need rehabilitation, dear students? You understand. A person with neurological disease, stroke, spinal injury, chronic neurological conditions, for example, myopathy, persons with different degenerative disease of nerve system, amputees, person with amputation of extremities, person with fractures, person with cerebral palsy, brain injuries, and other. before start rehabilitation, for receive good result of rehabilitation, we will assess functional condition of person. It's help get back to life. Да. Provide normal socialization, occupational person, да, do something, да, in the actual bathroom, tube, bedroom, in the kitchen, so patient can restore functional within an environmental similar to the one to which way they will be returning. How about continuously of rehabilitation? Rehabilitation is a continuous and coordinated process. Starts with the onset of an illness and going until the individual achieving a role in society consistent with her lifelong wishes. Teamwork, sharing of expertise and workload, patient-centered goals, cooperations, good communication, and regular team conferences are required in the rehabilitation team. Goals are adjusted over the time according to progress of the patient. How about onset of rehabilitation, dear students? It depends from type of disease. If person with disease receiving treatment in the hospital, inpatient department, we must start rehabilitation from very often. That it's requirements, many insurance, it's requirements of many medical associations, which it's requirements of scientific medicine. Many scientific investigation proved then early start medical rehabilitation, then early will be restoration, will be less complication in result of disease, and will be full restoration of function. If person needs emergency aids, medical rehabilitation start in the reanimation department. If it's ward, start in the ward. If haven't contraindication for provide physical rehabilitation, you understand, medical rehabilitation. If person have pathological conditions which is danger for life, for example, fibrillation of heart, or maybe collapse, that fall down, the blood pressure, or maybe bleeding, internal, external bleeding. Understand, it's contraindication for medical rehabilitation, but if person having contraindication, we must start medical rehabilitation as early as possible. In this case, we can achieve our goals of rehabilitation. It's full recovery or maximum optimization functional condition of person in the somatic plan society, occupational, social life, the occupational, uh, psycho-emotional state. And there are specific state of rehabilitation which have name inpatient stage of medical rehabilitation. Next stage of rehabilitation, it's outpatient department medical rehabilitation. When person discharged from hospital or rehabilitation center, the process of rehabilitation continues. In this process take part physicians, psychologists, social workers, occupational therapeutists, I said about this, and a member of family of patient. And patient also must have motivation for provide this rehabilitation. Also there are specific stage of rehabilitation, that it's third stage, the sanatorium stage of rehabilitation, or special when a person, for example, was in the hospital in the neurological department, for example, that discharge, continue rehabilitation at home, but next stage, it's rehabilitation in the special center rehabilitation, medical rehabilitation center or center of physical medicine, or in the sanatorium, that it's specific medical establishment, institution, which provide complex rehabilitation with using of methods of physical medicine and use nature and reformed artificial physical factors. And after discharge for sanatorium of rehabilitation centers, rehabilitation must continue. That it's chronic disease. For why it's necessary? It's necessary for secondary prophylactic prevention, different complication, which can be in result of a chronic disease or maybe impairment. I said in all period of rehabilitation, stadium of rehabilitation, rehabilitation provide multidisciplinary team, which include physical therapeutist, physiatrist. It's the main member of this. Occupational therapist, vocational rehabilitation counselor, physician, which provides treatment in the, for example, in hospital. This person have heart disease, and was maybe operation on the heart, a cardiosurgeon, or maybe without operation, cardiologist, or maybe together, this person take part in the rehabilitation. Also, rehabilitation engineer, assisted technology practitioner, rehabilitation technology supplier, vocational rehabilitation, considered necessary when there are speech problem, No, you can see the multidisciplinary approach which needs during process of rehabilitation. You understand, it's depend from type of disease impairment which have person with disability. Understand if persons have amputation in the multidisciplinary approach, control a surgeon, orthopedist, necessary prosthetists, community research. No, in always, dear students, you can see in the multidisciplinary brigade, it's physical therapy, it's occupational therapy. Family members help, multidisciplinary team in the release of rehabilitation program. Also help and actively take part in the rehabilitate hospital nurse and paramedical personnel. You can see in this picture illustrate the rehabilitation team, diversity of problem, spectrum of work to be done. Multidisciplinary team needed to restore optimum function in the disabled person. You can see it's many people, not only one physiotherapist or surgeon, it's many people which work together, and that in the center of attention this team is the patient. Okay, every member of multidisciplinary team have specific function. Physiatrist, the head of physical medicine rehabilitation team. In other names, like rehabilitation physician. Or physiatrists and medical doctors. Experts at diagnosis and treatment goals. Treat the whole person, not just the problem area affected part. Lead a team of medical professionals. Do you understand the important role of physiatrist? Is its chief head of team, which must provide diagnosis, assessment the conditions of person, patients before start treatment, and create treatment goals. Its treatment, its complex is not only one part affected, but in the whole person. It's very important, and it must do any physician treat not only one disease, and must treat person, patient, whole. In this case, will be good effect for treatment and fast restoration. Rehabilitation consultant, leader of the rehabilitation team, arrive at functional diagnosis, coordinates with other members and formulates a management plan, prescribe physiotherapy, occupational therapy, orthotics and prosthetics, performs rehabilitation surgery, addresses medical problems, friend, validate and guide to the rest. Also, physiotherapists must evaluate muscle strength, maintain joint range of motion, ROM, improve balance, use of physiotherapy modalities, PT, individualized wheelchair prescription, progressive gait training. Dear students, physiotherapists must provide assessment effectiveness of training, effectiveness of medical rehabilitation. How it's possible? Before and during physical rehabilitation, provide special diagnostic tests, functional tests. We'll study on the next lecture this more detailedly. And it's very simple. How can I assess? Is it successful rehabilitation or maybe not successful? After medical rehabilitation, after rehabilitation, the functioning can improve, should improve, must improve. If functioning ability of person not improve, for example, work capacity, range of motion in joint, strength of muscles not increase. In this situation, necessary provide modification of rehabilitation program. Manage and provide management new rehabilitation modalities. Physiotherapists must control this in the relationship with physician which provide treatment, that is the cardiologist, for example, or neurologist, or surgeon, or orthopedics. Assessment of disabled person. Its special areas. Identify and prioritize urgent medical problems. Assessment of functional status. Social history. You can see that the physiotherapist must control the process of adaptation patients to the social life. If there are problems, must correct this with help of social workers. If there are problems with adaptation and home work, maybe on the work, it's correct work of occupational therapeutists. Patients should control patience and career motivation, awareness, and distress. But in this situation, help psychologists anticipate case-specific complications and plan repeated assessment at appropriate intervals. All these medical and not medical observation must have special appropriate intervals. Systematically should be controlled for assessment effectiveness, the process of rehabilitation. Where delivery of rehabilitation care, institution-based, homes, outpatient clinics, community-based. Goal settings should be simple, measurable, achievable, repeatable, trackable, and should be short and long-term goals. How about methods which use for rehabilitation in the physical medicine? As usually, very important means for rehabilitation have exercise therapy. When used therapeutical exercise, coordination exercise, they improve coordination of disabled person handicap. Balance training, improve balance. Gait training, strengthening exercise which increase strength of muscles. Disabled person that if have, for example, any paralysis or plegia or maybe hypertrophy of muscles after trauma, person with neurological neuromuscle disease. Coordination and balance training uses usually for person with neurological disease that have ataxia, unbalanced, damage of cerebellum, problem with muscle tone, basic ganglion, and other. Mobilization exercise help disabled person improve range of motion in the joints. Endurance exercise help patients improve physical work capacity, endurance. Re-educational. It's exercise which help person provide educational person some skills, for example, result of brain trauma, maybe stroke, brain stroke. Person can forget how can walk, how can eat, how can open door. What re-educational exercise help in the recovery person. Educate, do this. Activate these skills. Massage techniques. Dear students, massage, it's mechanical influence on the soft tissues of body. Can use hand massage, but can use mechanical massage. In result, this procedure can improve stretching, can increase range of motion, can improve in duration physical capacity, can disappear hypertonus in the muscles, improve trophic process in the tissues, can improve nerves conductions of nerve impulses in the nerves and muscles. Also, massage have anti-edemic effect. If person have edema, can help. Also, massage in result of, it's same for exercise mechanism and massage. It's produce some biological active substances. It's endorphin, enkephalins, serotonins, which have analgesic effect. Therapeutic exercise have analgesic effects. If person have chronic pain, exercise, therapeutic exercise and massage can have analgesic effect, can have antidepressant effect and anxiolytic effect, anti-stress effect. No, we will discuss these problems of physical medicine more detailedly in the special lectures. Now you must have understanding this. Physical modalities of physiotherapy. For rehabilitation, very widely used physical factors. From ancient time, people, humanity, know about treatment effect, restoration, regenerative effect of physical factors. All physical factors divide on the two main types. It's nature factors, and preformate artificial factors. For example, about nature factors in physical medicine and medical rehabilitation, use heat, use cold, and have specific name: cryotherapy and cold therapy. Nature factors, where we can take cold in the nature, in the snow, in the cold water. For example, for understanding what's effect of cold? Analgesic effect, antiodemic effect. You remember, no? How about artificial cold, where there are specific apparatus, approaches, the apparatus which can generate cold. Can use refrigerator and ice from refrigerator. It will be artificial cold. And use cold pack. Also can use specific apparatus which generate cold air, for example. There are cold sauna, cryosauna, and other. It's artificial factors, physical factors. Heat can be a superficial heat and or deep heat. Where in the nature we can use heat? For example, in the warm sand, stones, it's irradiate heat. For example, in the cold water, there are special geysers and other. How about artificial heat? There are some methods, phototherapy, when use dry heat, or use diathermy, the shortwave diathermy. It's electric heat that use specific apparatus for generate heat. Okay. How about other factors which use that? For example, water, the aquatherapy, very widely used for rehabilitation person. Hydrokinesiotherapy, when use exercise in the water, combine two rehabilitation factors, water and exercise, therapeutic exercise, improve results. Or use climate therapy. Okay, next. No, we will discuss this more detailing, but also there are specific lectures that some bit late about physical modalities, physical factors which use for rehabilitation. Also used for rehabilitation very widely electricity. Use laser, ultrasound. Also use mechanical factors, traction, for example, and many other physical factors. Now we have a deficit of time of lecture, but next lecture I promised you I will explain you more detailedly about this. Okay. Orthotics and prosthetics. Orthotic, a mechanical device fitted to the body to maintain anatomical or functional position. Prosthesis, replace a missing limb. Attempts to restore function. mobility aids, improve mobility and stability, range from simple walking stick to motorized. It's very widely used in the complex rehabilitation of disabled people or handicaps. You can see in this picture some types of orthotics and prosthetics which use in the rehabilitation practice. Role of surgery in the rehabilitation. Close lesions between orthopedic surgeon and rehabilitation physician is needed. Decision of surgery carefully discussed and individualized. Soft tissue ethics always considered before bones. Tendon transfer and muscles re-education. Soft tissue lengthening procedure. Osteotomy. It's very widely used in the rehabilitation practice. Some words about functioning of rehabilitation nurse. She role also very important in the successful rehabilitation. She or he, the nurse, must control skin, bladder, bowel and stomach care. Helps on the transfer of ideas. Coordinates the family and rehabilitation team. Occupational therapist evaluates and trains on function relating to the self-care and vocation. Design and provide assistive devices to improve function. Helps in environment modification. Helps vocation needs. Speech therapist. Evaluate and manage communications problem. Assess and aid swallowing. Vocal re-education. Training the patient on using communication devices. Social worker. Evaluate the need of social services and guide the team. Coordinate between the funding, organization, and the team. Help in home and environmental modification. Principles of physical medicine and rehabilitation team. It's learning process, aims of physical medicine rehabilitation, rehabilitation team, physical medicine rehabilitation in different phases, lack of rehabilitation, prevention. Learning process. It is the basic principle of physical medicine and rehabilitation. Physical medicine rehabilitation specialists should know the principles of adaptation and plasticity of brain. What is brain learning? Dear students, what is plasticity of brain? It's ability of brain, cerebral cortex, and first of all, take on yourself healthy part of cerebral cortex, take on yourself the role, functioning, empowering part of cerebral cortex. Its ability of brain have name, plasticity of brain. Its principle, this ability laid down in the restoration process, in the learning, re-education. Understand theoretical background of teaching and learning principles. The member of rehabilitation team must provide educational of patient, should learn the modern concept of motor learning. Aims: treat the underlying pathology, reducing with the impairment and disability, prevent and treat complications, improve functional capacity, social participation, improve quality of life of the patient. In this schema, you can see the principle of rehabilitation team. Principle of work rehabilitation team. What is effect of lack of rehabilitation, dear students? I will repeat one more. Secondary prevention, it's rehabilitation, it's secondary prevention. Give very large economical effect. If there are a lack of rehabilitation, what can appear? Immobility, bed sores, contractures, muscle wasting, weakness, cardiorespiratory impairment. Dear students, hospital pneumonia, person can die in result not correct medical rehabilitation, in result of hospital pneumonia. Hypostatic pneumonia, another name. And result of cardio problem. What's cardio problem? Thromboembolism, dear students. Not correct rehabilitation after very perfectly operation on can be reasons died of person. Bladder and bowel problems, cognitive and behavioral problems, complications on underlying disease, poor functional capacity, social isolation. As a result, lack of rehabilitation, and or maybe died of person. What is conclusion? Main conclusion from our lectures. Rehabilitation must be always when person needs this, and should be enough. Then more rehabilitation, then better, then early, then better. Then early as possible must stop physical treatment, medical rehabilitation, complex rehabilitation of person. Its in result will be a recovery, restoration of person. prevention, primary prevention, diets, avoid injury or disease, exercise prevent traffic accidents by decreasing speed, exercise use helmets and seat belts. Secondary prevention, avoid effects of complication of the injury, prevent immobility, exercise prevent contractures. Tertiary prevention, avoid the effect of disease on person, treat behavioral problems, exercise unemployment after injury. Dear students, now I will show you short film video about rehabilitation. One clinical example. Oh, да, don't work. No, okay. Thank you for attention, dear students. Goodbye, good luck. Спасибо.